Okay, we're going to continue with the skinning of the cat in the upper region here. We've gotten one arm cleared off, and the skin has come off nice and clean here. No muscles on the skin. We're going to hope to do the same on the other side. So we are working our way here toward the shoulder. And again, you want to try to use your hands and fingers as much as possible, because there will be less damage done. And remember, the goal is to push all of the muscles, which are kind of pinkish in color, push them toward the cat and keep the skin that you're removing nice and clear and white in color. Okay, we're ready to make an incision here going over to the other arm of the cat. We've gotten this fairly well removed here, so we're going to make an incision toward the elbow. And now we're going to make our next incision up toward the wrist area. So we need to get the probe inside here, making way for our incision. We want to go up toward the area right here where the wrist bones are going to bend the paw forward. After we make a pathway for our incision, we can put our scissors in there, putting the pointed end of the scissors in. And then when we get it in, we lift upward and then cut. Okay, and we hope to see kind of a shiny white material, which is the connective tissue surrounding the muscle. And we're going to kind of get a grip on the skin, and then sometimes when you find the areas that are fairly tight here, it's oftentimes right around the blood vessels, you pull the skin as far out as you can, and then gently, going as close to the skin as you can, cut the muscles free and the blood vessels free. Then whenever you can, you use your hand to push the muscles toward the body of the cat. Okay, here on the lower arm, probably going to use a little scalpel action. So pulling it away. From the arm, just cutting through the fascia material. If you can get a good grip of the skin with one hand, it makes it a lot easier to push with the other hand. Right around the elbow area here, you probably have to do a little cutting again, but you can tell that it's going to be okay to cut because the area is not pink, but just kind of whitish, which means that you're cutting through the fascia material. Up here, you're going to cut through the blood vessel. I'm going to need to cut again a little bit here. When I get up as close as I can to the wrist area here, I'm going to make my way through the back side of the arm here. I'm going to take my scissors. Cut through the skin and make my last little incision. Okay. Now I'm going to push again, moving all of the muscle tissue onto the cat. Okay, so I have now got both of the arms cleared and the legs cleared. Now I'm going to make an incision down the midline of the ventral side of the body. So I'm going to use the same procedure. Going down here, I put my probe in, slide it back and forth a couple of times. Make sure that what I'm feeling is just nice, smooth skin. Then take the scissors, cut down. Okay, and there is some adipose tissue here. I'm going to find more as I go down further. Again, I've made way for another incision down here. Okay, and the white material that you see inside there is fat and fascia. I think I can make the last little part here. Okay, now I am ready to remove the skin. And I'm going to use my scalpel to make sure. There is some adipose tissue here. I'm going to let that go toward the body and just peel off the white skin. Sometimes the latissimus dorsi muscle, which is right here, is a tricky one that ends up sticking to the skin. You can see that I've gotten a little bit of it right there, but you want to make sure that even if it comes off with the skin, you put it back on the cat. Okay, as you're pulling here, moving down toward the abdominal muscles. Abdominal muscles are very thin muscles, so you want to be very careful not to pull them off. The best technique, again, is to push all of the muscles down as you're coming down here. And any fat also. You can always remove that later. But you want your skin to be coming off nice and clean. Looks like I've got a little bit of muscle on here, so let's see if I can't remove that, put it back. Okay, all of these little red vessels here going to the skin of the cat, you can feel free to cut those. And if your skin is nice and white and it just has a few little blood vessels on it, you're doing a good job. Okay, just about done with this side. The only place the skin is going to remain attached to the cat is at the neck. And I'm done with this side now. So this is how your cat should look at this point. And we're going to flip over and do the other side. And we'll be done. Okay, so right here, again, we're going to push all of the adipose tissue as well as the muscles down toward the cat. Just going to do a little, very careful with the cutting here, because as I said before, the abdominal muscles are very thin, and it's easy to get them to come up with the skin. We don't want that to happen. I'm going to keep the muscles on the cat. Now that you've gotten a fair amount of skin removed, it's easier to get a grip on the skin so that you can hang on to it real nice and tight while you push the muscles onto the body of the cat and separate them from the skin. Okay, the skin's coming off nicely here on the back. Just seeing nice white skin with a few blood vessels on it. Just about now through to the other side. Okay, where I can see the black glove coming through there, I'm free to just cut to separate the last little bit. Okay, I'm just about done. Just want to make sure that we're up to the back of the shoulders here. And that's it. There's the skin. There's the cat. Separated. You always want to, when you finish, you always want to use your skin, which should be all in one piece, and it's nice and moist, filled with preservative. So before you put your cat back in his bag for the night, make sure that you wrap the skin all around the limbs and as much as you can. Put them all back together again, and then put them in your bag, and we'll be ready to dissect the legs.